And new details now. The cause of death has been revealed for actor and comedian Bob Saget. His family says that he died from head trauma. Investigators believe that Saget accidentally hit his head somewhere in his hotel room and then died in his sleep last month. These new details, of course, raising questions about what other health factors could lead to something like this. And joining us live to talk more about it is our good friend and local neurologist, Dr. Romie Mushtaq. Good morning, Dr. Romie. Good to see you.
Good morning, Amy, and a pleasure to join you all this morning to discuss the news of Bob Saget's death.
Yeah, it's heartbreaking, and I think a lot of people assumed it was a heart attack or it was a stroke, right? And I'm sure for most people it didn't even cross their minds that he could have hit his head on something and then thought, oh, I'm fine, I'm just going to lay down. But this is not something that is uncommon.
It is not, Amy, and thank you for having me again this morning. You know, per the statement that was released from the Orange County Medical Examiner that was obtained by certain news outlets, it does appear that at some period Bob Saget hit his head and that there was a bruise at the back of his head. It can be assumed it was in the hotel room. There was no foul play, but it could have happened any time within a 12 to 24-hour period prior to that. What can often happen is we hit our head and have a slight headache or neck pain and don't think anything of it, that it's just a muscle strain. But unfortunately, there are certain types of bleeds, both on the outside of the brain layers and on the inside, that we can discuss that can lead to serious consequences. And unfortunately, this tragedy with Bob Saget.
Well, and doctor, you know, we think back to other celebrities, right? Because those deaths get a lot of attention. I think back to Natasha Richardson. She was skiing, exactly. She hit her head, right? She thought she was okay. And then she was gone just hours later. So talk to me about what that brain bleed, what that does, and why that can actually kill you.
You know, Amy, there are certain types of bleed in the meninges, either known as an epidural or subdural hematoma, that can just initially present as a little bit of headache and create a lucid interval where you are fine and clear and have no symptoms. But what happens is inside the brain, the blood starts to collect. And now we've often had a bruise on our arms or legs and the skin can expand and we get a swollen area. There's no room inside the skull, a hard bone, to expand. And so that starts to put pressure on the brain that can lead to very serious symptoms like a seizure, severe headache, loss of vision, loss of movement, and even coma and death, which seems to be the speculation of what has happened here. We don't have full details of the autopsy report to really understand the location and the severity of the bleed.
I think if there's a lesson in this for all of us, it's that if something like this happens to you, you've got to go to the emergency room. I would think that in an emergency situation, there would be some things that they can do to help.
Absolutely, Amy. The key is to obtain a brain scan and to look for signs of bleeding anytime there's head injury, and also a neurological exam. I want to also highlight that per the report here, and that the family made it clear that there were no additional recreational or prescription drugs involved. You know, certain prescription drugs like opioid or painkillers or even allergy medicines can make us dizzy and have a head trauma. Alcohol, when it's consumed even in regular amounts, can thin the blood and make you more prone to having a brain bleed. But we want to be clear that the family stated here and per the report that there was no alcohol or drugs involved. But yes, absolutely, anybody that's watching is to always get care and not assume that it's just a quote mild headache.
Right. God bless. It's just so sad. But it is interesting, of course, to know now what happened. And I think hopefully this will help other people who are in similar situations. Dr. Romie, thank you so much.
Thank you, Amy.